If you have numbness and tingling going down your arm all the way to your hands, or even if it's just going down to the elbow, and you've been in a car accident or had a slip and fall, stay tuned and I will tell you exactly where this stuff is coming from. It could mean that it's something serious, but most of the time it doesn't, but I will break that down in a second. My name is Anthony Wade. I'm a physician assistant and I help people who've been in car accidents and want to recover fast naturally. Also, people that want to lose weight. I kind of combine all those together because, the weight loss can help out with the healing and vice versa. So if you, again, have symptoms going down your arm like pain, numbness, tingling, burning, hot, cold, heavy sensation, I already said numbness, weakness, all this a lot of times is not actually in your arms. A lot of people think that, the problem is their arm, like they hit their arm or something like that, especially in the accident or the slip and fall. A lot of times it's actually coming from your neck. So let me back up a little bit. If you've been in an accident, you have ligaments and tendons all up and down your neck and back, they're all attached to muscles and bone. All of that stuff can get jerked around, pulled, stretched, or torn. It's going to cause pain and inflammation and swelling. And the swelling can affect the nerves. You have your spinal cord that runs down the middle. It also have nerve branches that come off. Those nerve branches come off. They go all the way down your arms to your fingers. And even if you just have some soft tissue swelling, it can press on those nerves. Let me give you a quick story. So recently, I was down in Florida and playing around in the pool with my daughter and on vacation with the whole family. And I tried to lift her up out the water and I cuffed my hands and asked her to put her foot in there as I try to lift her up, but she wound up kicking down. And long story short, it blew out my bicep tendon, which comes down and attaches to the radial bone on the outside. Tore that sucker right off the bone. So I had to have surgery. Here's the scar right here. I'm about 6 weeks out from the surgery, but they basically made an incision. They went in and they had to move all of the tissue, the soft tissue, the veins and all that stuff, arteries, whatever, out of the way, including the radial nerve that runs through there in order to get to the bone. And they had to reattach the bone, the bicep tendon to the bone. I'm not going to go into the details of the surgery. The point I was getting at was that after the surgery, I started having a lot of pain, numbness, tingling, burning, hot, cold, heavy sensations going down my arm. And, my arm actually wasn't even in the surgery, of course, at least not down here. But I was having the symptoms going down my arm. And the reason being is because in order to get to the bone to reattach the bicep tendon, again, they had to move everything out of the way. And when they moved everything out of the way, they irritated the nerve. And if you think about it, again, when you have when you've been in an accident and things have been jerked around, pulled, stretched, or torn, it's going to cause pain and inflammation. The inflammation can press on the surrounding nerves and move them out of the way, so to speak, same as when I had my surgery. So like I said, I was having pain, numbness, tingling, all that stuff down my arm, and it's gotten better over time. They used to be very painful to the touch. Now it's just a little bit of numbness. The thumb and the hand, all of this was swollen, which is now, all that has gone down. Thank goodness, thank God. But it gets better with time. And the same thing will happen when you've been in a car accident or a slip and fall and you have the symptoms going down your arm and you have a lot of swelling. You're going to have some swelling in that area. It can press against the nerves, disrupt them, cause all those symptoms, pain, numbness, tingling, burning, hot, cold, heavy sensation, and you'll feel it not just in the neck, which you can, but it'll send those signals going all the way down your arms. And long story short, it'll get better with time, but there are some steps that you need to take in order to make that process happen faster, to get all those symptoms to go away. And that's something that I help out my patients on a regular day-to-day basis. If you're interested in some of those things, I don't want to make this video super long. Just comment recovery in the comment section, and I'll send you over a survey that's going to basically ask you some questions to see if you're the right type of person that I can help with the programs that I have, including recovering from car accidents and also with weight loss. But like I said, type in recovery into the comment section and I'll get that survey over to you to see if I can help you out in some kind of way. But again, there are some things that could be going on that are more serious than just the swelling pressing on those nerves, including like herniations and maybe even like bone spurs or dislocations of the spine. And all those things you would have to be diagnosed by your regular provider, possibly get an MRI. That's going to be the definitive diagnosis to let you know what other things that could be going on that cause those symptoms. But like I said, if you want some more information, if you want to see if I can help you out with all these symptoms, show you some different techniques that you can do in order to get better, just comment recovery in the comment section and I'll get that survey over to you. So I hope this has helped you out in some kind of way, and it'll get better if you're having those symptoms. You just got to keep on doing the things that your provider and all the other people that's helping you out to help you to recover. If you want some help from me, just comment recovery in the comment section. All right, so talk to you guys soon.